This is Metatherapy, where we talk about therapy itself. Not advice, not diagnosis, just understanding the process so you can use it better. Each episode of Metatherapy is psychoeducation, not therapy. If something resonates, it's meant to be language you can bring back into your own work. Almost 10 years ago, Nicholas Ruchlewicz survived a traumatic brain injury. That's the headline. But what came after? 16 years of therapy, a hard reckoning with a trauma, and a transformation he did not expect. That is the episode. Most conversations about TBI focus on recovery, what the brain lost, what the body had to relearn, what the doctors said. That's not where we're going today. Today, we're going inside the process, what it actually looks like when someone uses CBT not as a technique, but as a way of confronting themselves. What it means to ask the hard questions, not the ones that sound good in a journal or the ones that you spend months avoiding. And what happens when the avoidance stops? Nicholas has told his story on stages in Congress, in articles and podcasts across the country. He does all of it as a passion project, not because he was trained to, but because he came out of the other side with something real to say. I want to get specific with him today, not the headline version of his story, but the inside version. What therapy actually felt like, what he avoided, what finally moved. That is where the useful stuff lives. Nicholas, welcome to Metatherapy.
Thank you so much, Dominic. I really appreciate the time, and that's a great introductions. I appreciate it.
Yeah, of course. Thank you. So if you would, could you take us back to the accident and not the details of the crash itself, but rather the first moment maybe that you understood that something had permanently changed? And what was that like?
So that's a difficult one. So every brain injury is different. Mine was a right side subdermal hematoma concussion. So right side brain injury can do like your vision, a lot of your emotions, the way you problem solve, and you know also your cognitive ability, your awareness. So I was injured March 15th, 2016. So 10 years and 1 month ago. Today's
Wow.
a uh, memorable day for other reasons, too. This was actually when I was released from the hospital. But I digress.
Oh,
So
wow.
I was taken right to a trauma center, but I have no memory of it. So even though I was never unconscious, I was never in a coma, I have zero memory.
Hmm.
And it's just that's how the brain is. Like I had what I thought were dreams, but it was my brain coming in and out of cognizant through the trauma unit. So I left when I always say I woke up when I was being transferred to the acute rehab hospital, which was March 27th, so roughly 12 days later.
Wow.
So that is still, I mean, it's still to this day terrifies me losing those 12 days of no memory, because even though I was there, I would respond to certain like we're going to go to dinner to get me to eat and such like that.
Uh-huh.
I had no memory of anything. I was very compulsive. I had to tie my hands down, tie me down in bed. Otherwise, I pulled staples out of my head, stood up, broke sutures in pelvis, a
Mm.
lot of stuff. But you want to talk about the good stuff about trying to when you kind of come to a realization. I don't want to say realization's a hard word because I had no idea what it was. I
Mm-hmm.
remember I always say my mother was in the room, my girlfriend's room, my father was in the room. It was like, why the hell would my mother and father be in the same room? What's going on? And they said, you were in a really bad motorcycle accident, you busted your pelvis, you had a head injury. I didn't understand why I saw two of everything. I didn't understand why I couldn't be my left side.
Mm-hmm.
I couldn't close my left eye. Um, but I couldn't walk. And I was like, okay, fortunately I would be able to, the prognosis was, you could walk again, and I didn't lose anything, fortunately, but I couldn't think of anything else. It's just like I don't know why I felt where it was. I mean, I didn't understand anything. And the next day at a acute rehab hospital, they do generally speech therapy, occupational therapy, physical therapy. And most people know what physical therapy is.
Mhm.
Occupational therapy is also regaining an independence. It's cleaning yourself, taking care of yourself, eating, grocery, whatever the case may be.
Mhm.
Speech therapy is something I always say I never want anybody to have to experience. It's because it was very so hard to be. I felt like I was being treated like a child. So the first
Mm.
therapist was my speech therapist, and she said, we're gonna work on a worksheet, we're gonna get these people in their schedule. And I said, this is the stupidest thing I ever heard. I literally manage construction crews for a living. I would never do this would be dumb.
Mhm.
And that's when I had to realize maybe something else was going in there. So that was trying to take apart the what was what I thought what things would be like, and what it was is reality is different.
Mhm.
I just thought, okay, I can't do certain things. I can't walk right now for 12 weeks. I'll be able to do it. But I didn't realize how much, I mean, I don't want to say how much their brain deals with. I mean, obviously we know our brain is what does everything, but how things felt different and how I had to relearn certain pathways in my mind. So,
Mm.
but again, I can go into any details we want. I know this isn't
Mhm.
about just the trauma aspect, but yes.
Right. So when did the therapy portion enter the picture? And was that your idea? Was that someone else's idea?
So therapy is very personal to me. So, um, before my trauma, I was in a really rough. I had a really rough separation, rough divorce.
Mhm.
But before that, I was seeing a therapist because I wanted to learn how to help my spouse out. They were suffering certain things. I wanted to be able to help them. And
Mm.
through that, this was in 2010. I was able to learn how to help myself. And I remember first going into therapy and saying, how do I do this? How do I do this? And I was like, I don't have any friends. I don't have this. And it's very different now, let's just say.
Mhm.
So I saw a therapist weekly. Through that, my separation happened, was rough. And, it'd be very easy is not a fair word, but it'd be very comfortable to just stay inside, play video games, watch TV, just mope. Well,
Mhm.
I refused to do that. I did not want to get stuck because I realized I might never get out of it. So I pushed myself to go out. I played tabletop games. I would go to different communities just to engage with the public. And that was, for me, I was able to help myself through it. So through therapy, my old therapist taught cognitive behavioral therapy, asking myself the tough questions,
Mhm.
where I was, why did what was the negative thoughts, what was creating this anger, what was driving these factors, and trying to deconstruct those. So then my trauma happens, and it's really fun.
Mm.
Brain injuries are very everyone's unique, and it's very isolating. I mean,
Mhm.
when you're trapped in your own mind, it's something that is I would never want anybody to feel that again. So I couldn't see my therapist in the hospital. I saw some neuropsychologists in the hospital, and obviously severe depression. I was never diagnosed with PTSD technically. It was
Mhm.
just severe depression, high anxiety syndrome.
Okay.
But also after the crash, I have severe ADHD. I was probably very high functioning
Mhm.
ADHD before, but the brain injury amplified that.
Mm.
But I was discharged. I saw my therapist. I was in a wheelchair. I had no hair, with scars across my ear to ear. I spoke to them. It was really rewarding. And then literally 3 days later, they had a heart attack, and I couldn't see them anymore. So it was
Gosh.
crushing to me. I mean, this
Yeah.
was a safety net I had for over 6 years, and what was I gonna do? I don't
Wow.
know how I was gonna get through it.
Mhm.
So I knew how. Number one, I said to myself, "Okay, well, she taught me a lot how to stand up on my feet. I can do this. So
Mhm.
I immediately went to try to find a new therapist, and I went to the major, sites to tell the different therapists, and you choose your insurance, choose what you do. Of course, I chose CBT because I
Mhm.
understood what that was like. I chose my insurance. Fortunately, I had good insurance at the time,
Mhm.
um, but I was able to the um, sorry, I was able to see, talk to therapists. I reached out to 5 of them. 3
Okay.
of them, um 2 of them never called me back. 2 of them said they weren't seeing new patients,
Mhm.
and, one of them said, "I can see you, but, I cannot, um, I can only see during the daytime hours. I don't see in the evening, just during day." And I said, I my mental health is very important. This is something I have to do.
Right.
So that's when I went in there, and the first time I saw her in July, I mean, I was still not walking. I was in a wheelchair. My girlfriend had to push me around. I mean, it was different. And then, slowly I'm going there with on a walker and other stuff.
Mhm.
Yeah. So
Wow. Yeah, that experience of reaching out to 5 therapists and getting 2, no response. Yeah, that's very typical,
unfortunately,
unfortunately, for sure.
yeah.
Um, was there a moment where, so with this new therapist, you were using CBT, and was there a moment where the CBT started to click in that work when it stopped being that technique and was helping you to start to understand yourself in this new world?
Yeah, I mean, I think she helped me try to challenge myself with what things were, and not, take away what my presumptions would be. She had me look at, the gifts that my trauma's given me, look
Mm,
at the experience that, I've been able to go through it. Um, and I mean, I still see her weekly, and it's very reassuring. And because when life gets hard, it's good to see there. And I tell people, therapy is not just getting in a corner and complaining for an hour. I mean,
right.
that can help get it out, but that's not therapy. That's called just, whine. I mean, I don't say whining. That's bitch. I mean, it's just
Mhm.
everybody knows what it is. So
Mhm.
it's not a sewing circle. It is something. So trying to stop certain, avenues from going on, trying to push myself to change that thought, change that pattern of
Mhm.
recognition. And, we can do a lot of cognitive distortions in it, and trying to replace what our mind thinks with what is really going on.
Mhm.
And did a lot of I don't like to say meditation because I don't like, but I did a lot of grounding techniques with her, like where you see what you feel. And
Right.
when things got really dark and gloomy, I would, say the names, the people that I'm fortunate to have in my life, and they have
Mhm.
me. So it really challenged me to not just, go one avenue, one thought process. It really did help me say, you know, my therapist still tells me, "Stop asking why. Don't say,
Mm.
'Why did you this?' or 'How.'" I don't say why a lot. I say, "How? How? How?
Mhm.
How?" I've learned to say after my trauma, "Why not me?" instead of "Why me?"
Mm.
But it was a choice I made in that. It was a difficult choice to do it. And also what helped me too with my therapy transition in the hospital, in the rehabilitation facility. So trauma survivors, I volunteer for that now.
Mhm.
But they weren't active when my trauma happened. But in the
Okay.
acute rehab facility, they have mentors that come in. I heard a person speak for about 5 minutes, but I had to leave because I was in a lot of pain. I don't say pain anymore. I say discomfort. But
Mhm.
they pulled me out of the room. But they said that they had a brain aneurysm, and they didn't know what numbers or letters were anymore. And they were a math professor. And I'm like,
Mm.
how can I whine about not being able to calm down?
Mhm.
So that was, kind of the jump start to say, okay, I want to do this because I want to push myself in the uncomfortable to show others that there is a path forward.
Mhm.
And I know that I never learned this till much later in my life about emotional intelligence. I know I have
Mhm.
a lot of it with me. I mean, I was abused in previous relationship, called dumb, this and that, but I didn't realize, certain things about me were different. Just 'cause I didn't go to college doesn't mean any of it no issues with my intelligence. I can also problem solve anything. It's just, and that's actually one of the hardest things for me. When my strongest aspect is solving abilities, when you lose that, it's like my strongest identity was gone.
Mhm.
And it still scares me talking about it. Like, people say, "What do you want to do when you retire?" And I said, "I don't want to retire, and I'll work till I die. Period.
Mhm.
And I
Mhm.
want to be productive because I know what it was like for me to have my not be able to do anything for 12 days. I know what it was like not being able to work for 4 months after injury. So all these things were this deck that was stacked against me that I had to break down that wall.
Mhm. Wow. Wow. Um, so from year 2 of therapy to year 10, so you're learning skills, you're learning insights, you're learning about how to think about your place in the world differently. What what would you say is been the trajectory in the last year, for instance? What is the work more about now than it was in those early days?
It's trying to still find ways to navigate my value of being here, of not trying to defeat myself for something that I can't control, um, trying to have more validity for being here because I still don't
Mhm.
understand. Again, I don't believe why me.
Mhm.
I say I have survivor's guilt. Unfortunately, there's nobody else injured but
Mhm.
me, but I have survivor's guilt because I don't know how other people wouldn't necessarily survive what I did. So I feel sad for them. Why did I have to heal? But
Mhm.
I've had to learn that healing is a lot of work,
Mhm.
and it doesn't matter if you feel like we're doing it or not. Your body is fighting everything it can. I mean, our bodies are trained with one thing, to stay alive. It's just what naturally we have to do. It's
Right.
it's like you can't knock yourself out with a punch. It's not
Mhm.
possible. Your body will stop it. It's just it's the nature of human existence, and trying to go through that difficult portion
Mhm.
is that challenge that we have to go through to get on that other side.
Right. Right. That's great. Um, the body is meant to stay alive. Yeah. I love that. It's very simple, but it's really profound and true. Um, you've talked about isolation as a major part of your experience. And I know that that is like, when people hear about trauma or hear about people having accidents, particularly TBIs, one of the, I think, fears is around this idea of isolation that can happen. Can you be specific about what isolation actually looked like for you, and not necessarily as a concept, but as a living thing?
Um, well, what it felt like was being trapped in darkness. I mean,
Mm,
'cause again, I have no memory of it, but it was my brain coming, into, but I do remember, ever quiet, ever cold, ever, I mean, just a darkness I couldn't escape. So that's the extreme version of isolation. That
mm,
is something I never want anybody to happen. I mean, it's so scary, but it's comforting too. It's a hard thing I don't like talking about because it becomes too much for me. But
mhm,
isolation was not being able to, I mean, be an adult male. I mean, I was 35 at the time, not
mhm,
being able to get up, not be able to clean yourself, not being able to eat. I mean, I was discharged again 10 years ago today.
mhm,
I was discharged in a wheelchair. I had a rough separation and divorce, so I was living with my mother. Nothing's more exciting than a 35-year-old male was in his mother's basement. We
mm,
had to buy a wheelchair ramp, take the handles off the wheelchair. I had no access to restrooms, anything else. So I had to have people cook for me, help clean up after me, and a drop down commode. It was great.
Mhm.
So isolation is also not feeling like you can contribute to whatever you have, maybe the world, maybe your career. It's a lot. I mean, it's isolation is different for everybody. One of the things I'll tell patients well, I don't like saying tell. I
Mhm.
will speak to patients about it is the one thing that we can speak about as trauma survivors, as TBI, as spinal cord, whatever, as rehabilitation, we can speak about isolation because it is isolating for whatever you thought what you're to be expected. Nobody expects this to happen. You feel the walls sometimes close in on you. You want to sometimes relax and stay in that bubble and not want to expand outwards because you're fearful of the world.
Mhm.
And those were the choices I pushed myself to. But one of the things I try to tell patients and try to encourage myself, the one thing that we can do as survivors, we can also help others show how to face isolation
Mhm.
by doing those hard choices to go out, see a support group, to go out to see a friend, to push yourself in that uncomfortable position because it sucks to walk after you're injured. I hated walking with a walker. It wasn't fun. It was
Right.
embarrassing, but I
Mhm.
had to. So it was pushing myself out of the comfort zone with it. And
Mhm.
that I think is, I mean, if avoidance grows anxiety, that's proven. And avoidance of something grows anxiety.
Mhm.
So isolation means you're going to avoid things that get you anxious or fearful
Mhm.
because again, our bodies want to survive. So they're going to avoid things that they're afraid of generally. It's
Mhm.
just how and they always say fight, freeze or flight.
Right.
I am a fight. Always been. I'm going to go for it. And
Mhm.
it's funny because I did a study with University of Binghamton in United Kingdom through sameu.org. But I talked to this wonderful British therapist, psychiatrist, and I said, I'm not afraid to fail, but I can't make a mistake. He loved hearing that. I was like, that's actually me perfectly. I'm not afraid to fail, but I cannot make a mistake.
Right. Right. That's awesome. I love that. So you've been to Congress, you've been given speeches, you've been a public advocate. How do you hold the public advocacy piece and also the private struggle piece at the same time? How do those kind of coexist for you?
Um, how do they coexist? I have the worst poker face in the world. When I advocate, everyone can be an advocator by just speaking out your needs and speaking the needs of those around you.
Mhm.
That's just how advocacy works.
Mhm.
I am not professionally trained. I don't do, but what I do is I push myself forward into that uncomfortable and be emotional in front of people, literally around the world on a podcast or
Mhm.
in front of senators, offices, whatever. I will be that because I will show that vulnerability. What Brene Brown said: you can't be brave unless you're vulnerable. You can't have courage.
Mhm.
Tom King, the writer of Batman, wrote, "It's okay to be scared. Everyone gets scared. Now's the chance to be brave."
Mhm.
Batman. So
Mm.
it's I've done a lot of cool things, and speaking about comics, speaking to writers, artists, musicians, again, advocating for my own injury, but also advocating for what helped me through my injuries.
Mhm.
That has been a good thing because that's been able to give a gift to others to show
Mhm.
them their creativity and how it helped me in a random spot. And that has also helped me greatly in my healing and being proud, trying to remember to stay proud of where I am and how I'm moving forward.
Mhm. Yeah, amazing. Yeah, and that, ties back into that you're talking about, having purpose and that meaning making that is so critical for human beings for us to understand, what's our purpose? Why are we here? All those existential questions. You've used the term gift of perspective. Can you talk a little bit about what that is, how do you use that framing? Um,
So my therapist, current therapist, she says, "What are the gifts that it gave you?" And I had to start naming the gifts of what I got. So when my trauma happened, I it was in March. My birthday's in August. Blah blah. So I couldn't do anything for my birthday. So I wanted to. The first mentoring I did, we basically had to come with 10-minute speech. So I wanted to record it. And my girlfriend's like, "Why do you want to record this?" I said, "Well, so many people came to help me, this and that. I wanted to do it, and my hospital therapist was going to be there, so I did this little speech. We recorded it, and then I said, and now my therapist is here. As everybody loves balance and lunging techniques, that's when I lunged forward and proposed.
Mm,
So that is the perspective because I had my hospital therapist there, and those many of those were at my wedding, and I
mm,
love them dearly. So I've gained sometimes so much more than I could have lost. If I talk about like, I don't talk about pain, I don't talk about it because I can start feeling it more, but I
mhm,
try to talk about all the stuff I've gained from it.
right.
I've gained ability to help people. I remember a patient one time asked me after I was talking to mentoring, and they said, "When did you become 100%?" And that felt like a slap in my face, like 100%. But I said, I'm beyond that now because
Mhm.
I can help people. I can do
Wow.
things differently. And that's what the perspective is. It's being able to see things like I viewed the world very well. I mean, I accepted people. I was very kind, compassionate, but my trauma took all the blinders off. So I
Mhm,
can see people where they're going. And, sympathy is when we're, looking down on someone. I'm so sorry about this. I'm sorry about that. But
mhm,
empathy is when you're walking with someone. So I try to
right.
push myself to always show someone like, I'm there with you. I will be there with you. And that's what advocating is. That's what that perspective is because I can't see it, but I have ability now to see it with you. And that's something that's very strong in me.
Mm,
So it made sense. It made sense as a way to say it. And so I'm very proud of being able to kind of create. I've told a patient this before, but we create our own narrative. Nobody can take it from us.
right.
So be your own author of your own story, and
Love that.
your
Mhm,
trauma, your injury, your you know isolation, whatever, didn't end in a period. It's just a comma. It's your story keeps going. So
mhm,
reminding ourselves that try to be the best, the narrator you can, and just try to always do the next right thing.
mhm. That's awesome. What words of wisdom do you have for the people who had that empathy after your accident and were with you, and had gone through that journey with you? Family members, partners, and so forth.
Can you ask that again before I start
Yeah,
crying?
yeah, absolutely. What words of wisdom would you give to those who were with you, who had that empathy, who were at your side doing this with you? Um,
That I love them and I'm sorry we went through this, but I would never want it another way because if one thing changed, I wouldn't be right here now. I've never thought of it like that. I don't know how to say it. I always feel bad that my family, I don't want them to suffer thinking what happened to me,
mhm,
but I know that I am very proud that we went through that journey together. And, I lost some friends from it, but that's okay because I've gained a lot more. And if I focus, I've tried to say that before to patients, if you expect to have ABC in the room, they might not be there, but, LMNOP will. And those people are there. They're in your tribe. They are there. And
mhm,
that's something that's really cool being able to do it. So I think that, trying to let yourself have a bad day. It's
mhm,
okay, and accepting what's there. And I promise the sun will rise tomorrow.
mhm,
And again, I could never thank more than enough all the people that were there to help me with my fight. I know I was fighting too. And I'm grateful that they were helping advocate for me when I couldn't. I mean,
mhm,
now my wife, I mean, she had was around a brain injury. She had a head injury from a horseback riding, so she understood certain things about a brain injury. I mean, fortunately, it was not as severe as mine, but so she recognized certain patterns and understood certain things to ask. So
mhm,
again, she helped advocate. My mother was something like, "Oh, the doctor said there's a small chance he'll never be able to walk. He might be paralyzed." Oh my gosh! So every single little thing was that was going to happen.
Mhm.
But yes, there was like a 10% chance I was going to get paralyzed when they fused my SI joint. I mean, smaller than 10%, but there is that chance. My
Mhm.
mother said you're going to have this happen. So again, I'm grateful for those, ones that were able to be there with me and love me. And I mean, I now have a wonderful relationship with my father from this. I mean, he was in a car crash right before I was born, so he understood certain things. And he
Mm.
said, you got to get through this, pal. You got to get through this. So sometimes when I get a little despair, I'll hear that voice like, you can get
Mhm.
through this, pal. Like you can do this.
Right. Beautiful. Beautiful. Um, if you could go back in time, post accident, and tell yourself something that would be helpful, what would that thing be?
Um, hold on. Hold on for
Mm.
the ride.
Mhm.
I wouldn't I wouldn't say myself I get the lottery numbers, but besides the lottery numbers, I would just say, you know, um, just hold on.
Yeah. Yeah.
And it's funny because my therapist asked me that before, and I've made some crude jokes like don't wear a helmet, stuff like that. But if I wouldn't wear a helmet, I would have died instantly.
Mhm.
But I would say to my younger self, just hold on. You're going
Mhm.
to have an adventure. And I know my younger self would be terrified of everything that I've been able to accomplish. And it's only been 10 years, and I'm trying to do more each day through it.
Mm.
So I would just tell myself, just hold on. And, you're loved, and just hold on.
Amazing. All right. So, do this thing called lightning round of questions. So, whatever your first response is or thought is, what is the biggest myth about TBI recovery?
That whatever it starts with, you're always going to be like that. It is brain heals very slowly, nerves heal very slowly. I mean, your brain has to rewire its pathways because it happens now doesn't mean it will happen then.
Hmm.
So that is the number one thing I could ever say because now doesn't mean then.
Hmm.
Very different.
Amazing. One thing that surprised you about 16 years of therapy.
That how important it would be for me to go and how powerful it feels to speak to others about that journey and
Mhm.
the hardship it was to accept faults with myself, accept humility, and how proud I am that I've been able to step through it and continue to move forward.
Mm. The question your therapist asked that you'll never forget.
Um, who wouldn't who would you not have if you weren't here?
Mm.
And I don't have to get far in that list until I break down beyond. So that was definitely something that I was not. It'll hit me hard, or something happened to me. She
Hmm.
doesn't know how she can do. And again, understanding our effects on others is really powerful, and it's hard.
Hmm.
It's hard to accept that I've really helped others the way I have. I mean, I don't want to give myself credit for it, and that's not fair
Hmm.
to myself. But it's just, I mean, I just do it. I don't know how, I just do it.
Hmm. Um, One thing you wish more men would say out loud.
That they need. I'm having a bad day, and I could use someone to talk to.
Mm.
Um, Male traumatic brain injury survivors is twice as likely to die by suicide than a regular male, and it's already almost like a epidemic for white men suicide.
Really?
And it's not TBI because again. it feels isolating. You're done. Why am I thinking bad about myself? Why
Mhm.
It's very important to speak, and the whole tough guy mentality is all BS. I said it in my keynote speech. TBI survivor, man, is the same emotions as any other person, just like a man, a
Mhm.
woman, and a child. Everybody's allowed the same. Women are only allowed to be not allowed to be angry, but everything else, and men are only allowed to be angry. Total
Mhm.
BS.
Mhm.
So find out what is your trigger. Like for me, anger is frustration and belittlement, and nothing's more frustrating than having someone clean up with yourself and not be able to think. Very belittling too.
Mhm.
So that would be my trigger. That's why I was very angry. So when you cry, when we get physical and stuff like that, that's how anger comes out. So
Mhm.
understanding that and then looking at what is the cause of that anger.
Mhm.
So, and what I try to do to fight my anger is when I feel frustrated, I will try to explain to myself or explain to others why I'm doing things a certain way. When I
Mhm.
feel belittled, I will take the time to tell other people how great they are. It's just the way I've been able to control the way my brain works against me. I try to make it to work for me.
Mhm. There you go. One last one. The difference between insight and integration.
Man, well, I'm an installer. I was like, integrated was when you make a system work. But I guess that works. Insight is understanding how to. I guess insight would be, I understand how to make it work. Integration would be, I'm going to make it work. Like I'm going to integrate those challenges, those parts, whatever. I'm going to integrate it into my my next steps.
Mhm. Awesome. Nicholas, it's been a pleasure. If people are interested in learning more about you, your advocacy work, how do they find you?
I wish I had more social media presence, but like I said, I do this as a passion project. But I have a little link tree at Gifts of Perspective.
Mhm.
I have an email Gifts of Perspective at Gmail, where I can help have someone maybe reach out to a trauma center, and it's been very powerful being able to connect. Like when I've made friends with Christina from the band Lacuna Coil, interviewing her, and it went, people around the world heard it and reached out to me and said how trauma affected them. I mean, trauma is the number one cause of death between 1 and 45. Technically, guns are 1 in 17, but trauma is the number one cause of death,
Mhm.
and it affects a lot more than we know. So it's important that people realize that there is help and support out there,
Mhm.
and I can, if I can help someone, if I help one person, I guess it was worth it, is one of the things I remind myself.
That's awesome. Thank you so much, Nicholas. Well, by the way, for those listening, we'll have the link in the show notes. Thank you so much. This has been amazing. And really informative. Well, I've certainly learned a lot as a result of this interview. So, um, the one thing that Nicholas said that sticks out is that answer to the end, insight, and the difference between insight and integration. Making it work between knowing something and actually being able to change it for the future. And that gap is where a lot of people get stuck, and it's where most of the work actually happens, not in the breakthrough moment, but in a long, unglamorous period of living differently after it. Nicholas has been in that gap for 16 years, and he's asked himself the hard questions, sat with the difficult answers, and kept showing up, not because it was easy, but because it mattered more to him than staying comfortable. And that is where therapy is supposed to be helpful, not to produce insights, but rather to produce people who show up differently. If this conversation landed for you, share it with someone who might want to hear about this work. And it may be worth it, even when it takes a long time. And come back next week and feel free to like the video and subscribe. My name is Dominic Adori, and this has been Meta Therapy. I'll see you next week.